Well, hello everyone. Welcome back to Take Back My Brain. I am your host, Lori Hammer, and today I have with me a topic that I've been wanting to dive into because I am now a new grandma and I got to experience a home birth with my son and daughter-in-law. And I always wanted to do that with both of my kids, and it just never happened. But I got to be there for the home birth, and it was phenomenal. Like, I cannot imagine. Really, unless there's something, out of the ordinary that you really need to be in a hospital for, I can't imagine like why nobody would want to do this. So this is for mamas who are thinking about it, or, family members who are like, I think our people are crazy because they're going to have a home birth. And I got that from a lot of people. Like, I can't believe they're having a home birth. Aren't you worried about this? So we are talking with nurse Aly McClain today. She is a home birth specialist. She has an amazing story. And so, Aly, welcome to the show.
Thank you so much for having me, Lori. It makes me so happy when I hear about grandmas attending home births.
It was
Um,
the best thing ever. Yeah.
is it so redemptive? Was
Yeah.
it redemptive for your own story, do you feel like?
I feel like it was.
Yeah.
Yeah, I do. Like both of my births were good, and very quick. But my daughter was born in the car, so it just been would have been way easier to have her at home. Um, but yeah, I would say there's a redemptive piece of it, but it was just to watch my daughter-in-law, just a deeper level of respect for her and a deeper love, and then watching my son just love on her and serve her during that whole time. Like I told him, I said, I didn't think I could love you more. Like he's mine, right? I've had him for 26 years. Like, how could you possibly love your child more? And it's possible. It's
Oh,
possible. And just the afterwards. And it's just been an amazing, amazing experience altogether.
well, congratulations. I love hearing those stories.
Yeah, yeah, it was so great. So tell me, how did you get into home birth? Have you always done home birth with your own kids? And I would love to know what piqued this.
Yeah, well, my story, I feel like maybe a little unconventional, but at the same time, the more I talk to women, the more conventional it seems like
Mm,
it's becoming. So while my story is not normal, it's also becoming less like abnormal to hear,
hmm.
especially medical professionals choosing to do home
Yes.
birth. So home birth was not really ever in my plans. I always knew that the body was connected, and I was fascinated with how the mind interacted with the body, which interacted with our spirit. And so that was always something I was aware of, but didn't know how to implement into my life. And I got pregnant. Well, to start off, I have been a nurse for over 10 years now. I've been married for just about the same time I've been a nurse, a little bit longer. We got married in college, and then right
Wow.
after we got married, it was about a year and a half later, we got pregnant with our first baby. And during that time, things start to shift. As a first-time mom, you start
Right.
realizing I have to take care of myself a little bit more,
Yeah.
and you're thinking about another person. But still, I went the normal route. I thought, as a nurse, I deeply care about my patients, right? And
Hmm.
I want their greatest health. But I had been taught one way
Right.
to bring health to people. And I figured that the nurses and the OB that I was hiring to help me would do the same.
Hmm.
Well, long story short, my water broke. I didn't go into labor, so they started Pitocin, which is induction, and that led down into a very traumatic and
Mm.
dissociative
Yeah.
C-section. I remember during the surgery, I had convinced myself my whole pregnancy I was having a boy, and they lifted her up slightly so I could see her when they delivered her. And they're like, it's a girl. And at that moment, it was like an out of body experience. Like, who
Wow.
switched my baby? Where's
Uh-huh.
my baby? And
Right.
so for the first 2 weeks I had her, I had to convince myself every day, oh, she's
Oh,
mine.
wow,
She's mine.
Allie.
There's no way that this couldn't be my baby because, I had to logically convince
Right?
myself. And so after that experience, I struggled with postpartum depression and anxiety for a year. It got so bad, I ended up having suicidal thoughts, considered leaving my husband and my baby behind because I
Mm.
convinced myself that I wasn't a good enough mother for her. And it was extremely traumatic. It was a very tough way to enter motherhood.
Right.
When I started coming out of that, I realized I never want to go through that again. At my 2 week postpartum visit, I remember going in, asking the doctor, why did I have to have this C-section? I knew during labor her heart rate went down. They took her out and they said, thank God that we did the surgery, that you were in the hospital because the cord was wrapped around her neck and she could have died. So that's all I knew. At 2 weeks, I went in. She didn't remember me or why she did surgery on me 2 weeks
Ooh,
prior.
that's tough.
She had to step out of the room, look at my chart. She came back in and said, well, your pelvis is too small. You'll never be able to birth the baby vaginally, and you'll need repeat C-sections from now on.
Wow.
So
Wow.
at that moment, I felt extremely crushed. I
Yeah.
felt like God had made a mistake. I knew I wanted a lot of kids. And I knew
Yep.
that having a lot of C-sections was extremely dangerous and not the way that I wanted
Right.
to build a family. And I was given no options. So I remember driving home with my husband, and it was something hit me in that moment where I turned and looked at him and I said, that's not going to be my story. This
That's
is not
awesome.
true.
Mm-hmm.
And there's no way with inside of me. I mean, there's a part of it that's intuition, and
Mm-hmm.
there's a part of it that I believe is the Holy Spirit saying,
Right.
you don't need to listen to a diagnosis, you need to listen to me.
Right.
And from that moment on, I started to research what my options actually were.
Nice.
So that's how I ended up finding home birth. And actually, I tried to do a birth center birth, but because I was a VBAC, they wouldn't accept me.
Right.
So home birth was my only option. And now
You're
it'll
sold.
be it'll be 9 years from my first birth that I started looking
Wow.
next week. And so I've been researching home birth and helping women home birth for a long time now.
That's amazing, Allie. Well, congratulations. I mean, I feel bad about your first birth, but it led you to, God makes something beautiful out of, something that was not a good experience. So,
Yeah.
congratulations on that. So, how do you speak? I mean, you just told your story. So, you have women listening to you. They're like, okay, I had a C-section the first time, which would you know the statistics? How many women have a C-section?
Yeah, about 32% of women in America are having a C-section.
Which
So about 1 in 3.
blows my mind. Like
Mhm.
our bodies were designed by God to have babies the way he designed them, right?
Mhm.
And we are I feel like we're being lied to from really from an early age till I'm going to be transitioning into menopause till now. Like, I don't feel like women get good care, and especially when, prenatal care, preparing to have a baby, and then the birthing process, and then you're just kind of left in the dark afterwards, like, huh, there's the baby, good luck, kind of stuff. So, what do you say to a woman who's like, okay, I've had 3 C-sections, and I don't, that was so traumatic for me, so traumatic for my family. Those were not good experiences. What can I do from this point on?
Yeah, that's a good question. So it is the thing about birth is one, I always look back to God's original design, right? And you had
Hmm.
mentioned that. So God designed the process of birth before the fall.
Right.
Before, like when we were in a perfect creation, He designed this to be a beautiful process that works. Now, just like anything in this life, most of the time it works, right?
Hmm.
When left alone, most physiological process, like you breathing right now, you're not telling yourself to breathe.
Yeah.
Most of the time your breathing works, but there are occasions where you need some assistance in
Assistance. Yeah.
breathing, right? Like if you get
Mhm.
pneumonia, you might get some extra help. And so we have to reframe what we even believe about the birth process before we make any
Any
decision.
decision. Yeah.
And so learning what that physiological birth process is, what God's original design looks like. And let me tell you, after studying it for almost a decade, it is fascinating. And I see God's character and heart for women time and time again when I look over how he created it. It's amazing.
Yeah.
The other thing I would say is we need to really tune in. Okay, so asking yourself, Lord, where do you want me to go? I
Hmm.
would say home birth is not for everybody. I'm not a home birth or die advocate. I'm also
Right.
not,
Right. That's good.
um, but I will, my phrase that you'll hear me say a lot is home birth should be considered as a first option for most women.
Right.
And then after you consider home birth and that's not for you, so let's say this mom who says, I've had three C-sections. And she thinks about it. She's like, actually, I feel more afraid being at home than I do the hospital. She's
Hmm.
going to have to decide if working through the fear of home is something that she wants to pursue, or if that fear of being at home makes it safer for her to be in the hospital.
Sure.
Because fear alone can really disrupt God's design for birth. And so that's something where I believe, and after the women that I've talked to, specifically in the past 3 years when I've switched to helping women prepare for home birth, most of the time women come to me and they're like, I know that I know that I know this is what I want to do. I just don't know how to do it.
Hmm.
Right. And so it's
Right.
that call on their heart of, for me, thinking back, I knew I was never going to go back to that hospital.
Right.
Right. Because I knew that it wasn't for me. So,
Hmm.
yeah, I think it is a very individualized question because there are women who have had three C-sections and had a beautiful home birth. And there's women who believe that that is not safe or okay for them. And I'm not here to convince anybody that
Right.
it is.
Right. Yeah. And you could have a midwife in the hospital too, right? So
Hmm.
both times I had birth, well, the second time I didn't make it to the hospital, but I still had a midwife. Um, and I would say my first birth in the hospital with a midwife was great. She was a huge advocate. I was 2 weeks overdue, and a lot of pressure from the OBs to like, we got to take this baby, we got to take this baby. And she was just like, nope, nope. She was the lady who the that would go to the mom is like, ooh, I can't make it to the hospital. And she would go to the home illegally and deliver those babies. Like
Wow.
she was just a phenomenal human being, and her heart was just that women would have an amazing birth experience. And so I feel like even in the hospital, like because she was so amazing, I had a really good birth experience. Like I wasn't afraid of anything. She let me birth in any position I wanted, and just the whole it was good. It was good. And of course the second one, I was in a car, and so nothing was like normal. Um, but it was fast, and I didn't have anybody breathing down my neck about anything. But so you can have good experiences even if you're not at home. So I love the fact you're like, it's not, ride or die in a home birth, but you have to decide what's going to work best for you as the woman, but also your partner has to be involved in that as well. And if they're not on board, then that makes it more stressful, whatever they're not on board with for sure.
Yeah, that is the truth. And I know with my first home birth, I knew that I knew that I knew home birth was for
Hmm.
me. And my husband was extremely hesitant. And at first, when I told him, he's like, no way, that's not going to happen. And there was a lot of conversations that
Sure.
had to happen. There was a lot of sharing statistics and I learned as a young wife how to communicate with my husband in not a way of demanding because I tried it and it didn't work, or
Right.
over informing, which I tried and it didn't
Didn't
work,
work.
right? Because they want to know the bare basics. They
Right.
want to know the facts, the logistics. And when I learned to communicate in that way, I also was able to set up an interview with a midwife. And I said, honey, just listen to the midwife, ask all of your questions to somebody that's not me Because
Hmm.
oftentimes our husbands don't hear what we are
Right.
saying unless somebody
Right.
else says it.
Yes.
And so having this interview with a midwife totally changed everything about choosing home birth for us.
Right. And because our hubbies want us to be safe and they want the baby to be safe, they're the men that God created to keep us safe. And so if there is any inkling that you're not going to be safe, they're like, "Hmm, red flag, red flag, red flag everywhere."
Exactly.
Yeah, so they have to be on board, but you're right. It has to be in a way that they are able to receive that for sure. Yeah. So one of the things I noticed in the home birth process is that the atmosphere is so much more calm. You just have so much more freedom. And I talk about our brain all the time. So I want to dive into how does having a home birth have a different effect on your brain as opposed to delivering in another atmosphere?
Yeah, that's a great question. So again, this goes back to how God designed it to work. We are mammals, right? So you think of any mammal out there, what do they do if you've ever seen a dog or a cat deliver babies? Do you go in there and monitor them?
No,
Do you strap them down to their bed and say you can't get out?
no,
Do you withhold water and food from them?
no, no,
No. Do you turn on the lights and make a lot of noise or ask a lot of questions?
no.
No, because God designed our brains to shut off that frontal lobe and go into our
Mm,
mammalian brain or it really is an instinctual brain. They call it that reptilian, which I don't
right.
like that
You're
word,
really, yeah.
but it's the most primal part of your brain. And that is where all of the hormones for labor are able to be released in a
Wow.
significant order and time, like specific time.
Wow.
And your body can have a feedback system. Whereas if somebody is constantly asking you questions or you are disturbed by the lights, noise, whatever it is, it will shut off that hormonal cascade that has to happen in order for labor to
Wow.
unfold and unfold safely as well. So a
Hmm.
lot of the complications that we are seeing in the hospital have to do with women feeling observed, not safe, and not taken care of, right? Their
Right.
basic needs are being withheld, such as food and water. Um,
Hmm.
so it's really amazing how our brains were designed. And at any point, so you have a system in your brain that releases the oxytocin in a rhythmic fashion, right? So
Okay.
every 3 minutes,
Yeah.
you're getting a dose of oxytocin,
Ooh, okay.
which causes a contraction. And that is giving a feedback saying, okay, I am getting a contraction. My body needs to release beta endorphins. And beta endorphins are what work on the same receptors as morphine. So
Right.
it's God's design to help you manage and transcend that pain. So you
Mm,
almost feel like you're riding on top of the sensations. You
right.
are very much aware of them, but they're manageable because you're able to stay on top of them. At any point, you feel safe or unsafe or observed, and that sends you into that fight or flight
Hmm.
mode, right?
Yeah. Yeah. Yeah.
And
Yeah.
being a mammal, what does our blood flow do? It
Right.
diverts to our limbs so we can run away.
Yeah.
And that takes all of the
Wow.
hormonal cascade. It interrupts that, so labor stops. You have blood flow that's not going to the uterus, which is causing problems with the baby.
Right.
So you'll see different heart rate decels
Fluctuations.
sometimes when
Yeah.
a mom is really nervous. So your brain runs the show. And we have to make sure that we are in the environment that is conducive the most to mammalian birth.
Hmm. Yeah. And I just think of even the process of like, oh, you're in labor. We have to run to the hospital because this is
Yes.
so intense. And how that can just that piece alone, not even getting there and being observed can affect the
Yeah.
birthing process. It has to.
Yeah, I often say that the number one or the very first intervention is leaving your home. because it does stop that hormonal cascade from happening. I wasn't even really in labor. My water had broken, and we called the hospital and they said, "Oh, your water broke. You should come in," even though I wasn't having any contractions.
Mm-hmm.
And just that ride and then putting an IV in and then putting a monitor on, all of that makes it
Right.
seem um like you're sick. And that's
Right.
a scary thing. And you're in a hospital, which is often seen as a place where sick people go. And
Right.
and then you're told to put on a gown because, you are the same as the cancer patient down
Right.
the hall there, right? And so all of this is subconsciously telling your brain you are not safe. You
Right.
can consciously be telling yourself, I'm so excited to have a baby.
Yeah.
But the reality is, you are in a place where most of the time sick people are going.
Mm-hmm. Mm-hmm.
And you're going to make decisions from a place of being a
A
sick
sick
person.
person. Yeah. Yeah. That's why when I have my clients, they're like, what do you know about birth and this kind of stuff? I'm like, make sure if you're going to have a hospital birth, you have to have somebody else there with you who can advocate. And it can't be your husband. It really can't be, right? Could you talk about that a little bit too? Because when we're in that environment, we have to have somebody who's more objective.
Yeah. Yeah. So that's when I started working as a doula, my main goal was to have the husband and wife be so trusting of each other, and that the husband would be the number one support person. So my
Right.
goal as a doula was to always come in and support the husband, support his wife. So I was more
Yes.
of a doula to the husband than I was the wife. And we would take turns on the hands-on, things. But we would always come up with a plan that as a doula, what I am is kind of like this roadblock. So when a nurse comes in, oftentimes she's asking me first, like, what do you
Hmm.
think about doing this? Or we want to do a cervical check. Can you let her know? So I'm not first roadblock. Then what do I do? To protect her hormonal cascade. She's in that deep labor. I know questions are going to pull her right back to her cognitive thinking, and we don't want her to be doing that when she's in labor. So I'm the first roadblock. Then the husband is the second roadblock. And what he is the authority in the birth room. Oftentimes, the doctor has usurped that role and says,
Hmm.
I'm the authority over what your wife does. And that we can just go into, that's a whole biblical, like, no, no.
Right. Right.
The
And I would
husband
love for you to address that. Yeah.
yeah, so the husband is the authority over the wife, and the husband is the authority in the birth room. He is the protector as the masculine figure. He's a protector and he is a provider. And
Right.
so his role in that hospital room is to protect his wife while she is the most powerful human being delivering a baby at that moment. And I think so often we as women think, wow, we need our husbands to protect us because we're weak, because we don't know what we're doing, because we can't advocate for ourselves. No, it's because we are doing the hardest work on the planet,
Planet. Yes.
and we need our husbands there to hold that space so we can do what we were designed to do.
Yeah.
And so he is that second roadblock to protect her
Hmm.
from questions, from interference. If we have done enough preparation beforehand, he is able to be really certain in if a cervical check is necessary at this point or not.
Hmm.
If an intervention is necessary at that point or not. And then we can talk about it. And if we determine that the wife needs to, this is important enough to ask her, then we can do that at that point. But that cuts down on a lot of unnecessary cognitive thinking,
Right.
which doesn't help labor at all.
No, no. Oh my goodness. That is so beautiful. And I got to watch that process, which was amazing to me. And I want every woman to experience that who can still. It makes me want to have another baby. I'll just say that. But I'm 51 and that's just not going to happen. But if I could do it all over again, I would want that type of experience just because I feel like I missed something, you know?
Yeah.
Yeah.
And
But
I would say too, one thing that I told my husband, he is the spiritual authority in the room too. And so
Hmm.
at our home births, I had written down Bible verses. I had um I had prepared him by saying, I want you to be praying over me
Hmm.
while I am in labor. Like I am going to be in it doing the work, and I
Yeah.
just need you to be that spiritual guard
Yep.
for me while I am in this. And I can't tell you how beautiful it
Mhm.
was
Yeah.
to have him read these note cards of Bible verses over me when I felt like I couldn't go on anymore. I was exhausted. It was hard work, but the word of God that my husband, the spiritual authority in the room, was reading over me and praying over me was
Mm.
something that bonded our marriage even more. And so often, what I'm seeing, and it's heartbreaking to me, is that after birth, at the hospital, I'll just go back to our last experience. We
Yeah.
were so thankful for the doctor. We were like, thank you for saving our baby's life, for
Sure.
helping, even though what had happened was the Pitocin was the reason why my baby's heart rate was so low.
Right.
It was not the nuchal cord. Um, but at the home birth, afterwards, we as a couple together were able to thank God. Thank you, God, for taking us through this. Thank you for
Yes.
being the good physician, for being there, for, strengthening us. And it was just a completely different shift in mindset of who we were giving glory to,
Yeah.
as well as the bond between my husband and I was strengthened each home birth we had
Oh, I
because
bet.
I relied on him so much.
Right. Right. And for him men are not empowered a lot in our society, right? So for him to be empowered in that way, to know that he was the spiritual authority, that he was your protector in that most vulnerable moment for you, your most powerful and most vulnerable moment, right? Like there was nothing that you could have done to protect yourself at that point in time. And like it's all, falling on him. I can't imagine like what that does to his brain.
Yeah.
I mean, we're talking about, the mama's brain, but the dad's brain in all of this has to change as well when you have this type of experience.
Yeah. It's really fascinating, actually. They can test the prolactin levels in a man after birth, and men with higher prolactin levels are more responsive to babies' cries and
Aw.
babies' needs. And I think oftentimes, if men are pushed to the side at birth and the nurse or the doula or the doctor is in full control and in full authority over that woman, now this is totally objective. I don't have any studies on this, but my theory is that the prolactin levels would be lower in a man who was during the birth than men who were more involved.
Oh, I could see
And
that.
because they're not in close proximity, they're not
Right,
operating in their God-given design.
right.
Um, and it's amazing the men that I have my husband and I coach couples together. And so
Oh,
the
wow.
men who have gone through this coaching and have supported their women, it's amazing to see the responsiveness. They change more diapers. They
Hmm.
help the women postpartum with more like home help so that they can recover. And I'm not saying they have to totally take over
Sure.
the, feminine role of whatever, but to see what their wife just went through, to
Hmm.
have this higher prolactin level that every time their baby cries, they want to respond. Like, how beautiful is that to have a responsive,
Right.
mutual parenthood instead of just the mom or just the dad?
Yeah.
That raises healthy children right
It
there.
does. It does. It solidifies so much. And that's exactly the way God intended it to be. Yeah. And I would say, just having experienced the home birth with my son and daughter-in-law, I think my prolactin levels raised too, because all I wanted to do, the few weeks following was just to serve her
Yeah.
in any way that I possibly could. I mean, and having a baby, grandchild is amazing, but just looking at them as a couple just amazed me. And I mean, I would do anything for them, but I feel like it
Yeah.
solidified all of that for me, for them.
Yeah, for sure. We definitely, every birth I would attend, we would leave with this dopamine hit
Yeah.
we're riding a birth high, like a mini birth high,
Mm-hmm.
as birth workers whenever we leave. And then the mom, we just know, is bathing in these endorphins and the
Yes.
dopamine and the love, and just knowing that she got to experience a birth the way that the Lord intended it to happen.
Yeah.
And she followed him, and it ended in that. It's the most glorious thing in the world, and you want every woman to just
Yeah.
know that that's a possibility out
Yep.
there.
Yeah, absolutely. So what do you say to, the would-be grandmas and grandpas and aunties and uncles who are very afraid? So do you have a message to them? Because even like my neighbors, because they love us, right? They're like, ooh, are they gonna have oxygen there? Are they gonna have this there? Are they gonna have that there? Are you sure this midwife knows what they're doing? Um, all of those things. Like, how do you speak to them?
Yeah. Well, I know it can be difficult, and one of the reasons is because we've been conditioned to believe birth is an emergency,
Right.
right? And so just to realize and become aware, if you are fearful of somebody else having a home birth, one, bring awareness and learn about what normal physiological birth is like.
Right.
And two, I would say coming from somebody who had previous birth trauma and needed to really protect my space, don't say anything. Because
There you go.
it's not your place to save somebody else who is beyond convinced that this is what God is telling them to do,
Right.
right? And so I think oftentimes we think we're doing them a really great service by telling them our fears, when in reality, I hear from moms all the time, like, oh, I told my mom that I was having a home birth and now she won't stop hounding me. We know it's coming from a place of love, but
Right.
it's also
Yeah.
coming from a place of fear, and
Fear.
projecting fear on somebody else who needs to be fearless going in.
Mm-hmm.
It's not helpful.
No, not at all.
I would also say to the parents out there who are considering having a home birth, be careful who you are telling you're having a home birth.
Yeah.
Not everybody is entitled to knowing that you're having a home birth.
Yeah.
Protecting your mindset is number one importance when you are preparing.
Mm-hmm.
So for my first birth, I knew that my family would not have been supportive. His family would not have been supportive. Some friends, for sure, coworkers would not have been supportive, and I would have had to continually be filtering out
Right. And you don't want
their
that.
fear,
Mm-hmm.
and I didn't want to deal with it. So we didn't tell them. And I will say, by my fourth baby, my mom had totally normalized birth in her head, and we had established boundaries where I felt like I could invite her to my birth experience. And
Wow.
it's so healing and redemptive, and such a beautiful thing for her to witness her grandson be born
Right.
at home.
Oh,
So,
yes.
yeah,
That
it's
is
really,
amazing. So amazing. Yeah. And I know I've probably done it too, projected fears about something on, other people. And I think it's something that we need to be more cognizant of in
Mhm.
every area of our life for sure. Yeah.
Yeah.
Yeah. So how has this changed, doing the home birth experience? Because clearly it's the natural way, it's the God-given way. I would love for you to speak about how it's kind of shifted your mindset about health and wellness as a whole, especially coming from that nursing medical background to this is really a radical shift just in that one area. And if I would be really surprised if it didn't spill over into other areas.
Oh yeah, it definitely started with being hurt and traumatized at my first birth when I realized that the medical system wasn't built for health,
Right.
because I I had been approaching birth as a medical event. But
Mm-hmm.
after my birth experience, I realized birth is not a medical event. It is a physiological event that needs medically managed sometimes.
Right.
And so when I saw birth as wellness, as
Mm-hmm.
health, as normal, then I started questioning everything that the hospital system, medical system was telling me about health. They
Mm-hmm.
knew a lot about sick care,
Yes.
right, in the
Hmm.
medical sense, but not a lot about wellness.
Right.
And so I realized during my first pregnancy, when I thought I was taking care of my body, what that looked like was eating boxed mac and cheese every day. It looked as eating bean and cheese burritos,
Right.
thinking if I swam 3 days a week that it would make me healthy. If I ate dates, then my labor would go faster. Ah, and then I took all of the vaccines that were
Hmm.
required of me because I didn't ask any questions.
Right.
And so when you have something happen where you trust somebody blindly and that blind trust hurts you, you start looking at every single area. So from
Right.
that moment on, I started looking at everything I was using household products wise, everything I was putting on my skin. I stopped using perfume. Our diets changed. It radically changed, over the
Yeah.
course of years, right? Because
Yep.
it's a
It's
process,
a
but
process. Yeah.
it radically changed how we started viewing our bodies. And I can tell you that we started to be healthier than we had ever been in the past. My daughter was constantly in
Mm.
the doctor's office the first 6 months of her life with ear infections, fevers, rashes, all of these things. And my husband and I constantly had strep throat and
Sure.
influenza and all of these weird illnesses that we struggled with all like
Hmm.
consistently. And then we started changing our lifestyle, and we have not needed to go see a medical doctor in almost 10 years, which is
Right.
so crazy to me to think how much our lives have
Right.
changed.
Yeah. I know, because you all of a sudden you realize what the body is designed to do. Like my kids have never had an antibiotic, like
Mhm.
neither of them ever, because we know how to take care of things, with herbals and those kind of things. Um, we get regular chiropractic care. Our diets are amazing. We exercise. We do all the things that you're talking about. And it's amazing what your body can do when you give it the right tools.
Yeah.
And just in daily life, but really in birth too, and preparing for that pregnancy. Can we talk just a little bit about that? Like, how do you counsel people as they're preparing for that birthing process?
Yeah, for sure. So, like fertility wise,
Yeah, let's
preconception,
go back
or
all
just
the way to fertility, like, trimester zero, as they call it. Yeah.
yeah, for sure. So, here a lot of women are struggling with severe nausea, and
Yeah.
and we have normalized how women are incapable of like getting off the couch and out of the bed that first trimester because they're so wiped and they're mineral depleted, but they don't understand because they're taking all of the vitamins that they need to be
Hmm.
taking. And what has been fascinating to learn is that when you get pregnant, that your body and your baby is actually taking from the last 3 months of your reserves.
Yep.
So, what you are taking now to help with these symptoms and to grow a healthy baby, it depends on what you have been eating and what you have been supplementing with and all this stuff for the past 3 months. So, especially like learning, do I have MTFHR,
Right.
right? Where do you need extra folate and B vitamin to help you sustain a pregnancy, to
Hmm.
help with managing the nausea?
Right.
Um, and it's really funny, a lot of women, so I still work in women's health as a nurse a few times a month. And a lot of women are coming to me like, oh, I'm so sick. My doctor gave me Unisom and B6. And I said,
Hmm.
and it's so interesting to see, like, yes, your body probably was depleted
Yes.
way before you even got pregnant.
Right. Yep.
So if you're preparing to have a baby, I would be highly supporting your liver.
Hmm.
I would be making sure you are taking a good amount of minerals, making sure that you are taking a folate, as well as knowing and having your husband be healthy because his
Yeah.
sperm can actually impact a lot of complications. They're even possibly linking like preeclampsia to the husband side
Oh,
of
really? I
things.
didn't know that. Interesting.
Yes. And so his health is very dependent on the complications that you could get later on down the road.
Hmm. Right. Which again is another empowering piece because so often we're just like, we put the
Yeah,
husband over here and we're just like, concentrate on the woman and we need him in the whole time.
exactly. Yes, we
Yeah.
need him to be healthy so he can fulfill his God-given design as
Yes.
well as we need to be healthy to fulfill ours.
Right. Because then you have better genetics, better genetic expression for the baby, and the baby's going to be healthier, you know, for the rest of their life if they start out healthier.
Yes.
Yeah, for sure. Is there anything you want to leave the audience with?
Well, I would say that if you are feeling a call to home birth on your heart, it is worth pursuing. And I would say it's not just worth pursuing and checking into. Um, the way that you birth matters not just for you and your future birth experiences, it matters for your baby, it matters for your marriage, and it matters how you enter into motherhood.
Wow.
And so if home birth is on your heart, I would say make a decision that you are going to pursue that with everything that you have until the Lord tells you differently. And
Amen.
I think a lot of times women carry around so much fear, which is pre-programmed into us based on our society, our cultural norms, our programming from TV and our
Right.
mother's births and our sister's births and all of this stuff. We have to deprogram what we have been told about it before we can really step into understanding God's design for
Mhm.
birth. And so that takes a decision. We have to make a decision at some point, which decide means to cut off the other options. Making a choice. I worked with a lot of women who would choose to have a natural birth, and I could tell the women who were going to go with the epidural versus not based
Sure.
on if they made a choice or a decision. And
Hmm.
so decisions are powerful. And I would say if that is something on your heart, decide that this is what you're going to pursue until the Lord tells you differently.
I love it. That's so good. Where can they find you?
Yeah, connect with me on Instagram at Peaceful Home Birth. I also have a podcast called Peaceful Home Birth, and you can find that on Apple, Spotify, Stitcher. I share birth stories of
Wow.
how God shows up during their birth. I also really give you practical ways to prepare. Meet me over there. I also do have a free home birth essentials checklist, so you can get that at bit.ly/home birth essentials. And if you want to go further, in my community and learn how to prepare using biblical principles, and you're 100% committed to having a home birth and preparing for that, then you'll want to check out our collective. And you can do that by DMing me on Instagram.
Oh, I love it. And I will have all that information in the show notes for everyone as well. So, Allie, this has been an amazing conversation. I really appreciate your passion, your heart, and your mission. You're changing the face of motherhood for sure.
Thank you so much, Lori, for having me. I appreciate it.
Absolutely. And thank you everyone for listening. Make sure you like, subscribe, and share this podcast with anyone who's considering home birth, or if you already know you want a home birth, give it to your family and friends so that you want to know that you're having the birth, so that everybody can be on board with you and understand, why you're choosing this process and why this is what God designed, right? So thank you so much, everybody. God bless, and we'll see you in the next episode.